Welcome to the Sprig podcast, your source for the most relevant topics in pediatric dentistry. I'm your host, Dr. Jared Johnson. Today, we have one of the most trending topics in pediatric dentistry to discuss, and that is minimally invasive dentistry with the use of Silver Diamine Fluoride. And joining me today on the show is Hayley Buckner. She is received a BS in nutrition from the UNR in Nevada and went on to become a dental hygienist at the College of Southern Nevada. And she is a professional relations manager with Elevate Oral Care. Welcome on the show today.
Thank you, and thanks for having me.
I think this is a really important topic to discuss because I think if you're not using this in your office, you're definitely missing out. Your patients are missing out. And I know, can you speak a little bit about Elevate was one of the first silver diamine fluorides to get FDA approval in the United States. Can you speak a little bit more about what that means?
Yeah, so Silver Diamine Fluoride was FDA approved here in the United States in 2014, and it first became available from Elevate Oral Care in 2015. And we've been the first and only available for a while now. And then there has been another one recently available on the market as well. But there are some differences in the two. Advantage Arrest is a great product specifically for these pediatric patients because it has a pH of 10, so it's very safe to use in and around any soft tissues. There won't be any soft tissue burns or anything like that. And Elevate is just excited and was excited to bring it to the market. It offers a lot of great different uses in offices. One of the great uses is around prevention, and we are a preventive-focused company, so all of our products stick right around prevention.
Yeah, I love the focus of the company. We actually use quite a few of your products at my office. For those of you, if you haven't had the Just Right toothpaste, that candy apple flavor is a huge hit with your kids. And it comes in a correct dispenser for 6 months. It's got a long shelf life, so you don't have to worry about it expiring. That's one I personally use because I have some incipient spots in my mouth and I don't want the work done. So kudos to you guys for coming up with these flavors and all these fun things for kids. I think you can actually you guys have a webinar coming up with Sprig, but you can also have one in office where you try out different products. I think the one coming up, we're going to focus on SDF, and you touched on some of the uses. I just want to give our listeners some of the uses that we can use it for. And then maybe we can discuss some of those here with Hayley. So you can use it as a diagnostic aid for caries. You can use it off-label to arrest incipient caries. Palliative care is a big one. Sometimes if we have a kid that comes in pain and we don't have a chair open to treat them, we can put that on, and the mom took time off work, the kid's out of school, and they go home and you don't do anything and they have to answer to the dad. Well, now you can put this on, get them out of pain, and then get them rescheduled at a time where you can actually take care of the problem. So that's a huge win for your office. You may have some kids that come from like 2 or 3 hours away. I see a lot of kids like that at my office. We see a high percent of Medicaid, and I can't get to everything at once. And this can slow stuff down until that family can get back. Sometimes finances are a barrier for them to even come to the office, so they might not be able to come back for a while. Huge one. I just saw this on IP delay or avoid sedation or general anesthesia. That is huge. You may have some kids with smaller lesions. You can slow things down until they're older and maybe do this without sedation. It's great to see the relationship you can build with the kids using a specific protocol that maybe we can talk about today that I use at my office. On label, you can use it for dentin hypersensitivity. This definitely will improve access to care for our kids, which is huge. And we know that there are a lot of underserved kids that need our care out there. Pediatric patients, huge benefit, like we already discussed with this reducing sedation in our office. Older patients in nursing homes that may not be able to get in, that's probably really tough right now for them. This could be a huge benefit for our geriatric population with the COVID restrictions. Patients with special healthcare needs, smart technique is a huge one. I would encourage a lot of people to pick that up. And then also indirect pulp therapy. So what all these excites you the most, Hayley?
Well, improving access to care is huge, and especially right now, even during with COVID and all these regulations, Silver Diamine Fluoride gives us an opportunity to treat a patient, and with using that smart technique, the silver modified atraumatic restorative treatment, it allows us to then go in and restore over it, and it reduces. It's a non-aerosol producing procedure, so that in itself is very exciting right now. And then the prevention aspect, not only can we use this to arrest these lesions in patients, we can also use it for these moderate to high risk patients to offer the best form of prevention that we have available to patients. There's a lot of great research out there on that. There was an article came out a while ago out of the California Dental Association Journal in January of 2016. There's actually a section of that article where they said annual application of silver diamine fluoride prevented many more carious lesions than 4 fluoride varnish treatments do in a year. So that is awesome that we have another tool in our belt to offer prevention to these moderate and high risk patients.
Yeah, you mentioned the SMART technique. So can you explain a little bit more what is the SMART technique and how it might be useful for someone at their office?
Yeah, absolutely. So SMART, silver modified atraumatic restorative treatment. So this allows you to go in, you can apply silver diamine fluoride to that carious lesion. And then either that same visit or at a different appointment, you can restore over that. And it eliminates the need for any local anesthetic or drilling. So it's just applying the SDF, covering it with glass ionomer or composite, whatever it is that you choose. And again, there's no needle or drilling and a non-aerosol producing procedure.
That sounds like a very comfortable dental visit. We've definitely done this. It's very successful. I know there's a lot of people that are kind of skeptical and maybe think it doesn't work, but I can tell you numerous 6-year-olds that have hypoplastic 6-year molars that we had one this other day come in for her 3-month recall. So my protocol is we'll put on, the silver diamine fluoride or the Advantage Arrest at their first visit, have them back in 2 weeks and do a second loading dose at that visit, 2 weeks apart, just because of the amount of silver that's in the product. You don't want to go over the EPA's regulated drinking water maximum. And then at that second visit, I'm going to place an interim therapeutic restoration and a high viscosity glass ionomer, and then they're going to come back every 3 months and we're going to reevaluate things until I can fix it. We just had one come in the other day and everything was rock solid. I told the dad it was working, and their other child had to go under anesthesia at the hospital. So we just saved them the risk of anesthesia and thousands of dollars. And I think when she comes back in the next 3 months and we get our recall x-rays, that we're going to be able to restore that under local anesthesia with probably nitrous oxide, minimal sedation, and you just build trust with your patients. And that's what really excites me. If you can get people on, like I said, you guys are based on prevention, get them in early. And if you can catch things at a point where it's small and not a deep carious lesion, you can have great success with these techniques. So I would encourage you to maybe consider that at your office for some of these kids that have not a lot of needs and are a little anxious. And it's a great way to do dentistry, and it works. And I've seen it work, and I've done it numerous times on 6-year molars, and it's just so much fun to see the kids grow and the parents build trust in you. So applying it, that might be something that there's a lot of people that, how do you apply it? They're just starting to get into this and they want to know what's the correct steps. The AAPD has guidelines, a resource for you too, but what are you recommending for applying your Advantage Arrest?
Yeah, so it's really a foolproof application. It's recommended that you just do a simple cotton roll isolation. I know a lot of people like to isolate with a dry angle. Just dry the area as best you can. Apply the silver diamine fluoride site specifically to the site that you're treating. And ideally, you want to let it sit there and soak in for about a minute. And then after the minute's up, the latest recommendation is to cover over that with fluoride varnish. That varnish step acts as a little protective layer or seal for the SDF to kind of continue to work and penetrate undisturbed for a little bit longer period of time. And then patients greatly appreciate the varnish step as well, because silver diamine fluoride has a pretty strong metallic flavor. So the varnish does a very good job of masking that metallic taste that comes along with the SDF.
And there are some varnishes that you guys offer that come in a few different systems. You have one that's a bottle system that can save quite a bit of money if you're looking at, costs for COVID going up. Can you speak a little bit more to the fluoride varnishes and the different flavors that you had?
Yeah, absolutely. So we have our FloorMax Varnish. It's a totally innovative fluoride varnish. It's the only 2.5% sodium fluoride varnish available. So it's actually half the concentration, but that's because the chemical makeup of it is different. We eliminated that thick, sticky colophony base that other varnishes are made of. So this one is a liquid base. It's like 40 times thinner than a traditional fluoride varnish, and it's made from a food grade shellac. So very, very thin, and because of that, you can dispense it out of a bottle system, literally by the drop. And you can dispense out a drop, so if that patient's not due for a full mouth fluoride varnish treatment that day, you can just dispense out a drop to cover those 1 or 2 sites that you treated with SDF. or you can use it for full mouth application as well. And for a pediatric patient, you only need 1 drop for their entire primary dentition. So it's breaks down to about 16 cents a drop. For a permanent dentition, you would need 2 drops, so about 32 cents for an adult fluoride varnish application. But yeah, very cost effective, very comfortable since it's not thick and sticky. It's also hypoallergenic and hydrophilic, which is great in that pediatric population as well.
What about some of the other things we need to be considered, like staining of the product? Are there any things that we should be considered when we're applying it, or caution we should take when we're putting this on patients?
Yeah, so silver diamine fluoride can definitely, it's going to stain a Caries lesion black, which will be permanent, and that's when that smart technique can come in handy if the tooth stain is an issue. But as far as soft tissue goes, it can cause a temporary discoloration on the soft tissue. So you can use Vaseline on the surrounding soft tissue to kind of act as a barrier and prevent that discoloration from taking place. But it goes away very quickly, and it really causes no issues to that soft tissue other than that temporary discoloration. So intraorally, that discoloration goes away in about a day or so. Extraorally, it can linger just a couple of days longer than that. You also want to be sure to cover the patient's clothing with a bib because it will stain clothing, and we have not found anything to get it out of clothing just yet. And operatory surfaces can be stained as well, but if you catch it while it's still wet, you can quickly clean it up on your operatory surfaces with an ammonia-based cleaner like Windex or Lysol wipes to prevent it from causing a permanent stain there.
Yeah, be careful with the ammonia and how much you use. I got it on the floor one day, and I dumped way too much out, and I think the gases were a little too much for me to stay in the room. So just be careful with that. But I keep a bottle of ammonia by, and it's pretty cheap. I think it's less than $1 when I got it at the hardware store to clean up anything, because yours is tinted blue, correct? That so you can see it where it is. So that can be beneficial as well.
Absolutely.
What about contraindications to SDF? Are there any that patients we shouldn't be using this on? Anything that you've heard of that people have had problems with it?
Yeah, if the patient has stomatitis or any kind of inflammation in that area, it would be contraindicated for them. Also, a silver allergy would be contraindicated, but silver allergies are really not that common. So, you know, if the patient's telling you they have an allergy to some kind of silver jewelry, it could be like nickel or something, which is still okay to use this. It would just be a true silver allergy that you would want to avoid using the silver diamine fluoride.
And then how are we going to work with, I guess, how do we get reimbursed for this? Because this is kind of new. There's some changes coming up. I think you're going to cover some of this, but what are some of the billing codes that we could consider using? And maybe we want to check with our insurers and see what they're covering.
Yeah. So if you're using this to arrest a Caries lesion, the code that you would use is D1354, which is a Caries arresting medicament, and that became available in 2016. So it's still a fairly new code, but we know that about 1/3 of private insurance plans are covering it, and over half the state Medicaid programs are covering it. And the feedback we're hearing is offices typically charge about $40 per tooth with that. And then if you're using it as a desensitizer, you can code it at D9910. And then an exciting new code that will be available starting January 1st of this coming year is D1355, which the nomenclature for that says it's a Caries preventive medicament application. And that's because there's so much research out there on the preventive benefits of silver diamine fluoride. So again, it can be used site-specifically on these at-risk sites in the patient's mouth to offer that greater level of prevention than traditional fluoride varnish would. And for that now, you'll have that code available, 1355, which just like 1354, those are both a per-tooth code. You can code that for any of those at-risk sites that you're placing the silver diamine fluoride on for prevention.
Can you give us maybe an example of a situation where we may want to use that 1355 code that's going to be new? Because I think a lot of people are going to have a lot of questions about when do I use the 1354? When do I use the 1355? What's the difference? And can you dive into that a little bit for us?
Yeah, thinking about a lot of the listeners here and being pediatric, you know, this can be used for pediatric patients where, as we talked about earlier, that, this is nice to buy you some time until patients can sit through actual restorative work and then maybe eliminate that general anesthesia altogether. Well, same thing from a prevention standpoint. If we have a pediatric patient, a small child that has maybe all their primary teeth, so you have not explored sealants on those patients yet because maybe they can't really sit through sealants, but they've got some of those deep pits and fissures and some at-risk occlusals. You can apply Silver Diamine Fluoride to occlusal surfaces, and as long as it's reapplied every 6 months, it will act as a true occlusal barrier, just like a sealant does. So for those patients where they're at risk, but they cannot sit through that more technique-sensitive sealant, you can use this as more of that foolproof application and apply it every 6 months to act as that kind of occlusal barrier. So that's a preventive benefit to those more at-risk occlusal surfaces. And again, whatever occlusals that were at risk, you can site specifically apply it and then code that $13.55 per tooth that you would be applying it to.
Yeah, so it'll be interesting to see what that picks up with insurance, because I know on primary teeth, we have these spots that become, white and chalky or an incipient lesion forms. And while a sealant would be great, many insurance companies don't pay for sealants on a primary tooth. So this could be, another alternative to offer some of your higher risk patients. And it may be a little more cost effective too, because the cost of the material is going to be definitely a little bit different than the cost of the sealant material. So I'm excited to definitely see where that goes. Have you had any people run into challenges with billing the code and then not being able to restore the tooth or things along those lines? Because I know every insurance company is a little different in my area.
So that's really what we hear is, all these insurance companies are different. So it just kind of really depends on that plan. We always recommend that just bill for what you do and, hopefully you'll get some of that coverage, but no specific rhyme or reason. All the plans are different. So no real feedback there on that.
Yeah, it puts us in a difficult situation when you want to practice within, put it on 2 weeks and then put a restoration in there to prevent food impaction so the lesion doesn't get bigger. And they tell you you've got to wait 3 months to restore the tooth. They're not really, insurance isn't always what's best for the patient. So,
Right.
but just keep in mind some of those challenges that you may face with applying this. One other question that we might have if someone's just starting out with this in their office, how do they have this discussion of informed consent with the parent expectations? Those are kind of some questions that people might have as well on trying to get to the point where they can start delivering this type of care.
Sure. So it is always a great idea to use some kind of an actual informed consent form anytime you're using this, really no matter how you're using it. That way the patient understands there's that possibility of that staining that could take place in the tooth surface and that possible temporary discoloration on the soft tissue. And it's something that you do want to have that conversation with patients about. But never let that really hold you back, because this is just another tool that you have in your belt now where it's really our ethical obligation when we have these patients chairside and we identify an area that needs to be fixed and an area of infection in that patient. It's our job to really lay out all of those different options that are available to the patient, let them know the pros and cons with Silver Diamine Fluoride as you would with anything, and then help them to make the informed decision on what's the best treatment plan for them moving forward.
Yeah, it seems like some parents they're kind of on both ends of the spectrum with what they want. You have some parents, we have people that come, we have articles on our website of, keyword optimized for Silver Diamine Fluoride. And you have some parents that find you because they don't want their child sedated. And that's a great tool to offer them. And then you have the parents that are like, well, I don't really want to make, 18 trips to do this plan. I just want to get everything done at once and I want to go for the sedation. So I kind of see both ends of the spectrum, and we definitely have the conversation with all our families of both options and then let them decide. They're both fine with me. It's if they want to choose that, and we can discuss the risks and the benefits. And most of the time it's a pretty easy thing to get through, and they're pretty happy with the choice they make. They both work. There's multiple ways to do things in pediatric dentistry. So it's really exciting to be able to offer this solution. I also wanted to add that when you do purchase the Advantage of Rest, it does come with a nice little flyer for you to have images to show parents what it looks like before and after. And then they also have some other materials they ship with it to help patients see their caries risk and focus on prevention as well. So keep that in mind. And then also, I think you guys just came out with a new bottle system I saw the other day. Is that true?
Yeah, it's exciting. So, with COVID, we've had a lot of requests for offices to have smaller bottles so you can stock one in each operatory to, control a sepsis and just to have it more readily available, especially now with this new prevention code that's available. So, we came out with a 3-bottle kit. Our current bottle is an 8 milliliter bottle, and our new 3-bottle kit has 3 milliliter bottles. So a little bit smaller so you can stock them in each operatory from your hygiene ops into restorative. Makes it a little more readily available for any of the clinicians in the office to use it.
Well, that sounds exciting. I think that a lot of hygienists will be excited about that if they're allowed to apply it in their state, and just make it a little more convenient so you're not having to go and have a kit you got to fetch. So thanks again for coming on our show today. Is there anything else that you wanted to add?
Yeah, I just want to let you guys know, if you are interested in the product, we have a team of preventive care consultants across the country that can either come into the office, or we have ones that can do a virtual visit with you. We provide continuing education and walk you and your teams through everything you need to know about Silver Diamine Fluoride. No charge, and we'd love to be able to come in and educate your staff and answer any questions you guys have. So you can visit our website at elevateoralcare.com, and there's a link right there to request a staff meeting, and just fill out the information and we'll get in touch with you. Thank you so much.
Thank you for listening to the Sprig podcast. If you enjoyed the show, be sure to subscribe, leave a review, and share on social media. If you have any questions, or if you have a topic you would like to hear covered in a future episode, please email podcast@sprigusa.com.